Now, once they affixed the patibulum, what they did to the victim was that they would elevate the bond, the stipes, and depending on the type of cross, if it was a tau-shaped cross, it would actually sit on top like a capital T, or if it was a Latin-shaped cross, which we're not actually sure was used, it would be probably 2/3 or more of the way up on this horizontal beam. They would take and they would affix the feet to the front of that stipes. Now, in the movie, they use a post, or what they call a sepednium. And the sepednium was a little supportive piece for the feet. Well, what we know from the time of the Romans, at the time of Christ in that region, that probably was not in use yet. And so they probably just drove the nails straight into the front of the cross. And they would do this through the second metatarsal space, which would be just underneath the tarsal bones of the feet. And when they did that, it would also kind of damage or disrupt the deep peroneal nerve, and probably also hit areas of the lateral medial branches of the plantar nerve. So there were nerves that were actually damaged when they drove those spikes through the hands and the feet. Once that person was affixed to the cross there, any pressure that they put would cause extreme, excruciating pain, to be shot in waves up the legs and through the wrist. So that it was a very painful process to be nailed to the cross. There was also a small little seat that they had. It was called the cedulum. The cedulum was actually for them to kind of halfway sit on. It wasn't enough to fully support their weight, but it was just enough to give them enough of a perch to prolong their suffering. So this was kind of a prolonged, torturous death that was meant to go on for possibly days, and caused an extreme amount of suffering in the process. Now, from what we know about Jesus' condition at the time that he was crucified, we notice that during the clips that he collapses at one point in time. We know from Scripture that a man by the name of Simon of Cyrene had to pick up his cross and carry it for him. And what we can ascertain from that is that we know that Jesus just underwent an extreme scourging. We talked last week about how in that process the flesh is ripped from the back. There's a lot of deep lacerations and a lot of blood loss. And when you've got that much blood loss, your body has difficult time sustaining blood pressure. You start to enter a condition called hypovolemic shock. Now, when you're in a state of shock, in modern terminology, we now differentiate into compensated shock and decompensated shock. The difference is, can you sustain a blood pressure? And what we can see from Jesus' collapse on his road to the cross was he was starting to enter that point where he was not able to sustain a blood pressure to where he was able to stay upright anymore, and he was starting to collapse. So we know that he, at this point, was having some problems with hypovolemia. He was starting to enter that shock phase, and on top of that, he was about to be nailed to this cross.
Thank you, Dr. Fuller. Brandon, let me ask you this, kind of shifting gears a little bit. You work on a college campus at Tusculum every day, or at least most days, and we know that, we were there every day. We just don't know how much you work there, but I'm kidding. But we know that some of the most irrational rationale comes from the intellectual side of life, and from the educational camp, from skeptics and conspiracy theorists and all that. Can you talk a little bit about some of the theories that are out there concerning the crucifixion and death of Jesus? We're going to watch a clip in just a moment outlining the death of Christ, but can you just elaborate on that a little bit?
Yeah, absolutely. There are at least 3 major theories that are being taught on our campus at Tusculum, and probably at most campuses across the United States. One is a very popular theory that actually comes out of the Muslim tradition. Muslims believe that Jesus somehow was miraculously delivered from these events, and that he escaped to India, and they actually have a burial site. And so that's certainly one plausible theory, is as intellectuals who don't who are not comfortable with the idea of the miraculous, they're certainly going to say, well, the reason there's an empty tomb is because he was never killed, he was never buried, he escaped to India. Another popular theory is a theory called the swoon theory. A lot of people are familiar with that just from going to church. But the swoon theory says that, yes, Jesus did suffer from hypovolemic shock, as Dr. Fuller just spoke about, and that's evidenced by the fact that he did collapse on the road to Golgotha, but that he also collapsed again, and that collapse took place on the cross. And that Jesus never really died. He just fainted, or he may have passed out on the cross. They took his body down, put him in the tomb for about 3 days, and in the nice, cool, damp air of the tomb, his body was not resurrected, but it was revived. And so that's certainly another theory. And then the other big theory that's out there is that there was a mistaken identity that took place. That when Simon is asked to come along, Simon from Cyrene was asked to come along and help Jesus carry the cross, that he carried that cross all the way to Golgotha. And there may have been an exchange with the prisoner, handing him over to other soldiers, and that they may have mistakenly identified or crucified, rather, Simon from Cyrene rather than Jesus Christ. So those are 3 popular theories that are actually being taught on our college campus.
And I know we'll revisit those
We
to some
definitely will,
degree
yeah.
in a